Thank you, Commissioner, for giving us the local landscape. I know we're all inspired to watch the development of the work under Genomics Australia, and thank you, Matt, for the overseas inspiration. I think one of the things that Matt mentioned was leadership from the top in implementing these enormous and complicated pieces into our ecosystem. So it is my great pleasure to bring the very voice of leadership in health, aged care. Mark Butler has joined us. I know the room's very keen to hear you address on some of the issues in this space, Mark, and thank you so much for joining us. Welcome.
Well, this just gets bigger and bigger. Not sure what venue we're going to be able to provide you next year if you keep growing. Thank you, Christine, for that introduction, and I heard the back end of Tiffany's presentation, so thank you, Tiffany, for that and for taking on the role as Commissioner of Genomics Australia. We're really excited about what this new body is going to deliver, not just in the rare cancer space, but generally in bringing the health system into alignment with the enormous opportunity genomics brings to us. I want to acknowledge the traditional owners of these lands, the Ngunnawal people, and pay my respects to their elders past, present and emerging. I think you had Auntie Selena give you a warm welcome. She gave one to the Midwinter Ball last weekend, which was a much rowdier crowd, I can tell you, in a bad way. I'm not having a go at you, I'm having a go at them. But thank you to Auntie Selena for being such a regular welcome to country guest. So Anne Ruston, I think, has just joined us. I want to acknowledge the Shadow Health Minister. There's so much that we agree upon in this portfolio that we have the honour of stewarding for government and opposition respectively, and I know there's lots that we want to work together on in this space as well. To Rare Cancers, thank you for organising what is now a really significant annual event in the parliamentary calendar, bringing together a whole lot of disparate voices to have a discussion, a really important discussion about some of the opportunities and challenges. Obviously, to Kate and Richard Vines for your stewardship of this amazing organisation over many, many years, but to Christine and the team who work every day in delivering reports like the one Tiffany just talked about. Thank you for bringing us all together. As you know, we delivered our response to the Senate inquiry, I think last night in the Senate, and I'm sure you all stayed up late reading line by line the response that we've delivered. But I want to thank the community for your participation in the inquiry, particularly the voices of lived experience, patients, carers, clinicians working in this space as well, and advocacy groups like Rare Cancers Australia. It was a really energetic inquiry, about 150 submissions and about 41 recommendations from the Senate, which, for all the jokes that we have in the House of Representatives about the Senate, delivers great report through inquiries like this, and this is no exception. I hope you get a chance to look through our response to it. I want to talk at a bit more length about a couple of elements of this report, but also about the latest Rare Cancers report, because I think, married together, these are really important focal points for governments, but I know as well for many stakeholders who are in the room today. The Now It's Personal report, a little bit more concise in its recommendations, only 6, but each of them really, really chunky, meaty recommendations for us to get our teeth into. Not just as a Commonwealth, but a number of them, I think, are really good opportunities for discussions with state and territory colleagues about how we can work together to meet some of these challenges. Some of them, as Tiffany said, go to data, and particularly systems around genomics and precision medicine, and I'll talk about that in a sec. But I want to reiterate the importance of the role Genomics Australia is going to play in pulling together some of these long-standing questions and giving us very clear advice as a government and to states and territories about how we can do things like build that data framework that is a clear recommendation in the Rare Cancers report. I want to talk, though, about a couple of things that we are doing which were canvassed in the report. I want to thank RCA for your participation in the Nursing and Navigation program. This is something I'm really proud of in our government. It was a core recommendation underpinned by a consistent theme in Cancer Australia's National Cancer Plan, and that was to lift all tumour types, common or rare, to the highest possible standard of care and support. And you know and I know that across the cancer space there have been a variety of navigation and nursing programs put in place, usually by terrific advocacy organisations, patient groups like RCA and many others. And it was certainly my ambition, and it was Dorothy's recommendation, to try and lift all of those boats to the highest possible level, recognising that in some areas we needed that tumour-specific approach that Rare Cancers and many other organisations continue to give through their funded support services, but also recognising that there were other areas of the navigation and nursing support space where we could take a more tumour-agnostic or cross-tumour approach, both in terms of the navigation support that the Cancer Council gives, but also the nursing program that the McGrath Foundation is leading for government on behalf of all cancer groups in the sector. And I'm really glad that that was recognised as one of the recommendations for us to continue in the Rare Cancers report, and I can give you that assurance that we do intend to continue it. Research, I think, is also an important part of our response to these challenges. And as you know, we're in the process now of developing our roadmap for the $150 million low survival cancers mission out of the MRFF. And I know that a number of people in this room will be working with government or with the department to design that roadmap and make sure that we get the biggest bang for those $150 million. And thank you for those of you who have done that. I'm really looking forward to the publication of that roadmap so we can get on with the job of starting to issue grants in that really exciting mission. But there are a couple of really important things happening around what I know has been the core focus of Rare Cancers, and that is the treatment gaps. Not just the late diagnosis and a range of other challenges people with rare and less common cancers experience, but also some of the treatment gaps that people with more common cancers are frankly not experiencing. I know there's been a bit of commentary around the PBAC decisions around a broader access listing for the two really common cancer drugs, Keytruda and Opdivo. As you probably know, Opdivo is going back to the PBAC later this week. It was a deferral decision by PBAC. The company is taking it back to answer some of the questions that I think were implicit in the deferral decision by PBAC. But I know there'll be a lot of disappointment in the room at the decision around Keytruda, which really does have a lot of potential for a broader access listing. Frankly, I think there are things that the company and the department can do to make that proposal more attractive to PBAC. I think, for example, the fact that the application was restricted to TGA-registered conditions does mean that some of the rarer forms of cancer probably were excluded. But anyway, that's ultimately a matter for the sponsor and the department and PBAC to work through. This is a really important opportunity to close some of those treatment gaps that do exist in rare and less common cancers. On the more positive side, though, I want to, I think, pick up a comment that I heard Tiffany make when I was coming in to reinforce the excitement we have in continuing funding for three really important precision medicine supports or programs in Zero for kids, which we've now expanded to young adults as well, and Prospect for adults and the Rare Cancers portal. I think one of the challenges that we are having, and Genomics Australia is going to help us with, is how we move from a research focus, because these are programs that have been funded through research dollars, into this becoming standard care. I mean, it is for kids now, pretty much. How do we move this into just standard care treatment funded in the usual way through the healthcare system rather than by research dollars? And I think that's something we're looking to Genomics Australia to work with those organisations on. But in the meantime, what we were committed to doing, and I know Anne Ruston and the opposition supported us in this, was to give those really exciting programs that are delivering such amazing results long-term funding certainty, while not just the Commonwealth but with states and territories as well, we work out what some of the longer-term funding arrangements for those programs might be. The last thing I just quickly want to mention is that I know a number of you will be really interested in our response to the health technology assessment review. As you know, we've had an implementation advisory group working hard on this. They've provided me with a report that I've been considering over the last several days. There'll be another event tomorrow night where I'll have a few more minutes to talk more expansively about my views on that report. But I want to thank the people who've particularly been involved in that group. A couple of them are here today. I was particularly keen to make sure that rare diseases voice was represented in that small group, and I thank Nicole Millis for taking on that particular role. But I know a whole bunch of people in this room have been feeding into this review from its earliest days into some commentary and submissions about what we should focus on as priorities as we consider the report of the Implementation Advisory Group and the further work that we know the IAG is going to do. So thank you again for inviting me and Anne to come and spend a few minutes with you. Thank you for the work that you do in your advocacy, in the day-to-day treatment and support that you give, or if you're a person with lived experience, the strength you show in talking about your experiences to improve the quality of the conversation at a national level and hopefully the outcomes for people living with rare and less common cancers. All the very best for the rest of your day. Thank you.